you can always look back and share with your loved ones. And we're still going to deliver all we have to give to you this morning.
Do you have any birthday shout? Because I have one.
A big birthday shout out goes to a dear friend, Sai Balogun and his wife. Today is their day. And a big shout out to this lovely couple. To God, even though they are no longer together. But each time they celebrate, this person will be celebrating their husband, this one and you see some celebrating both husband and wife. So it goes a long way to let you know that irrespective of how far you are, some things still connect.
I think I love the synergy between the both of them when their son was graduating.
Yeah.
They are always there, they have
because we are separated or we're divorced doesn't mean that we should be out of the well-being of our children. So it still goes a long way. We should still be friends. Let's just go on like that.
Okay, so I have a birthday shout out to my baby, turned a big girl now, Gladys. It's a good thing when you're not a child, grow and become an adult. So this is happy birthday to Gladys. I love you. Thank you for being that wonderful, good girl that turned into a brilliant lady. Yes, for her class, she didn't mess herself up. She's focused. She has built a brand for herself. So she should be maybe in her early mid-20s thereabouts. Yeah. So happy birthday to you. I love you. Like I told you, she said, "Oh, Mama," I said, "I love you." So celebrate.
So happy birthday to Gladys, and to everyone celebrating on this beautiful day.
Yeah. We love you. We love you. All right, on that, let's go on our mini feature, and when we return, we'll start the conversation with our very handsome, very own pharmacist here waiting. He knows me. Don't worry, we'll be right back.
Toilet infections. Toilet infections, also known as urinary tract infections (UTIs), are a common health issues affecting millions of people worldwide. These infections occur when bacteria enter the urinary tract, causing symptoms such as pain, burning, and frequent urination. In this write-up, we will explore the causes, symptoms, and prevention strategies for toilet infections. Causes of toilet infections. 1. Bacterial contamination. The most common cause of toilet infections is bacterial contamination, typically by E. coli. 2. Poor hygiene. Failure to maintain good hygiene practices such as wiping correctly and washing hands can contribute to the development of toilet infections. 3. Urinary tract abnormalities. Abnormalities in the urinary tract such as kidney stones or an enlarged prostate raise the risk of developing a toilet infection. 4. Hormonal changes. Hormonal fluctuations during pregnancy, menopause, or puberty can affect the urinary tract and increase the risk of infection. 5. Weakened immune system. Individuals with weakened immune systems, such as those with diabetes or HIV/AIDS, are more susceptible to toilet infections. Symptoms of toilet infections. 1. Painful urination. A burning sensation or pain when urinating is a common symptom of toilet infections. 2. Frequent urination. Needing to urinate frequently, even when the bladder is not full, can be a sign of toilet infection. 3. Cloudy or strong smelling urine. Urine that is cloudy, dark, or has a strong odor indicate a toilet infection. 4. Pelvic pain or discomfort. Pain or discomfort in the pelvic area, lower back, or abdomen can be a symptom of toilet infection. 5. Fever and chills. In severe cases, toilet infections can cause fever, chills, and other flu-like symptoms. Prevention strategies for toilet infections. 1. Practice good hygiene. Wipe correctly. wash hands thoroughly and avoid touching the genital area to prevent bacterial contamination. 2. Urinate when needed. Urinate when the need arises rather than holding it in to prevent bacterial growth. 3. Stay hydrated. Drink plenty of water to help flush out bacteria and maintain a healthy urinary tract. 4. Avoid certain foods. Some foods, such as spicy or acidic foods, can irritate the urinary tract and increase the risk of infection. 5. Wear loose-fitting clothing. Wearing loose-fitting clothing can help reduce moisture and prevent bacterial growth. Treatment options for toilet infections. 1. Antibiotics. Antibiotics typically prescribed to treat bacterial toilet infections. 2. Pain relief medication. Pain relief medications such as ibuprofen, acetaminophen can help alleviate symptoms. 3. Urinary tract analgesics. Urinary tract analgesics such as phenazophrine can help relieve pain and discomfort. Toilet infections are a common health issue that can be prevented and treated with proper hygiene practices, prevention strategies, and medical treatment. By understanding the causes, symptoms, and prevention strategies for toilet infections, individuals can take proactive steps to maintain a healthy urinary tract and prevent these infections.
Okay, welcome back. Yes, today's conversation on our Healthy Thursday. We will be discussing toilet infection. Behind the camera, I was saying, this is one topic I dread so much. I fear it. Because when they start the analysis, when you see all these health people, the medical doctors, the pharmacists, when they start the analysis of toilet infection, even your own toilet, you're scared to sit on it. But hey, don't worry, that's what knowledge does. Knowledge is power. And today we are going to be having a conversation with our pharmacist, our handsome pharmacist in the building. Even though he ran away from me for a very long time now, he's been busy. See how fresh he's looking. Good morning to you.
Good morning. Good morning.
I told you I will take something. So either your chain or your wristwatch. I say wristwatch is masculine. Just drop your chain.
Do you have any chain?
The hand chain is holding now. I saw it. My eyes are sharp enough. I don't want to take the shirt now. Don't look at me that way.
What can we do?
You don't have a chest. What can you do?
You know what? It's high time your girlfriend will start suing.
Please, let
I'll
us
surely back her up.
Yes,
You know,
please,
situations like
Zoo
that.
me. That out of you. I'll join both of you together and collect everything from you. Welcome to the show. It's good to have you a very, very long time. I know you've been very busy.
How is work?
we are moving up.
Your patients are not troubling you too much.
Not too much. Not too much.
Not too
It's
much,
okay,
right?
but it's not too much.
That's interesting too.
Yes.
Okay. Toilet infection.
Yeah.
Now, I know that as a pharmacist, you've always had people come over the counter. Oh, I have itching. Oh, I think they'll just tell you, I know I have toilet infection. Just give me drugs. Just give me medication. We'll get to that point. But what is toilet infection and what causes it? What is toilet infection and the basic causes of toilet infection?
Okay. So, toilet infections are just infections coming from the toilet. It's a hygiene problem. It doesn't necessarily have to be from sitting on the toilet itself. It's just basically a hygiene problem, and then you get infected. And infections come from bacteria, fungi, parasites, and viruses. So these are the major 4 things that could infect the body. So basically, what we are just talking about is these microorganisms coming into the system through the, let's say, the urinary system. Usually it's the vagina and the penis that get affected in this particular kind of situation.
Is there any particular sitting position one needs to, when you're on that seat, on that closet?
Is
Is
it
there
to,
a particular way you need to sit to avoid being infected? Now, let me try to break it down. Now, you're sitting on the toilet seat,
okay.
and you know, sometimes some will see the vagina will be touching the edge of the seat. And some will tell you, no, I actually sat very well. My vagina was not touching it. And now, to the men, all respect, you know, the protruding penis can also be, does it have to be the tip of the penis, or you need to sit, you know, sitting to take the whole of the, you know, the balancing and covering the whole seat. You understand what I mean?
Yes.
Or you just leave a particular space whereby air can always come out.
And some will say you need to stand on top of the dressing too.
No, that one is even risky because it can damage and it can get broken and help injure you. So, but now, do you need to sit on that to avoid the infection? Do you have to sit in such a way that you have a space from this side and also from the back?
Okay.
Or you sit and cover the whole arm of the toilet?
Occupy it, like, you know?
Okay. So,
to avoid infection.
yes, rather than thinking about the sitting position, because it usually affects how you stool. You could pull easier when in some certain positions, but it doesn't affect because you could sit and then water, like maybe poop,
Water from the
goes and splashes up, right? So the better thing to do would be to make sure that the toilet itself is clean. Yes, you disinfect the toilet because the toilet has so many microorganisms.
You know the reason
so
I'm
many.
asking that question?
Okay.
For those who go out and you want to use
Public.
the public toilet. Public toilet, it doesn't really have to be the one in the marketplace. Public toilet is still the convenient to use when you go to very 5-star hot hotels. You have people working inside. There are some hotels where like sleeping. You see many take pictures because in the convenience, you know, and you're like, wow, this is beautiful. I forgot to use the toilet. So that's why I'm asking that question, because I'm like, but this looks so clean. I know I was sitting in such a way. In short, some will tell you if it's pee, I don't need to. But you know, no matter how rich you are, sometimes you enter certain, it's still public because you know the only one having access to it. Even the one in your room, if it's a service apartment or whatever, you're not the one that will use it, though it's clean. Is it possible to get an infection from that?
Sure, it's very possible. Although those clean toilets you can have minimal microbes there. The cleaner the toilet, the better. But it's still a thing of microorganisms, meaning we can't see them with our eyes. It might appear clean, like this table now looks clean, but if I take a swab from here and take it to the lab,
Of course.
you see how many
of course.
organisms are there.
Definitely.
So it's better to have a cleaner toilet, but it doesn't tell you that, okay, I can't get a toilet infection from here, because you can be cleaning it, but it's not being disinfected. So because it's not being disinfected, you could still have infective
Now, what relationship
microbes.
does sexually transmitted diseases have with toilet infection? Can you help us with that? 'Cause I know there are two different things. STD is different from toilet infection.
Yes.
So what relationship do they have, you know, that merge them together?
Okay. So for the sexually transmitted diseases, it's just from the name, sexually transmitted. So it's just basically gotten from sex. While the toilet infection is gotten from hygiene issues. You're having a poor hygiene. So for example now, for ladies, you might be cleaning from the back forward and nobody has ever told you that. So you could go and take some microorganisms growing around the anus and then bring it into the vaginal area, right?
So you're supposed to clean
from the front back.
Yeah.
Yes. So if you wipe back forward, it's going to be an issue, right? Now there are some people who wear tight on this, yes. So yes, and you sweat a lot and all. You take a lot of time before you change those underwears. It becomes an issue. You now have microorganisms growing there. Then this one is not. It's not really, because I know people don't like the drugs, but antibiotics, they have a way of killing off bacteria. So they can kill both the bad ones and the good ones, especially for people that like self-medicating. They just have sex. They come. I say a lot of them come to the pharmacy. They tell me, I want to buy one Ampiclos. I wonder where they've gotten that information from. So yeah, so they just come in. They say, just give me Ampiclos. I just had sex, unprotected sex, and I'm looking like there are also different things you can get apart from bacterial infection, and that's the only thing that Ampiclos can help you with if you take the full dose, right? So you come in, you take this antibiotic, it kills off the normal flora. That's what we call it, the good bacteria in the vaginal area, and then you come down with infections, because the bad ones, they have this way of growing fast. It's the good ones that are preventing them. It's balancing the whole vaginal area. So once you kill off the good ones, the bad ones, they take over easily, and you start having itching and all the normal symptoms now. Yes. And then for men should normally, I know Nigeria is somehow, sometimes you can see people peeing on the road and all that. So yes, before you pee, you're supposed to wash your hands and then pee. And when you finish, you still wash your hands again. So, and it's this kind of things that you just do. Maybe you walked outside, you just come, you pee, and then you go and sleep with your wife.
You mean someone like Joy on the road?
You
You will not know. You wouldn't know. See, COVID helped us a lot.
Yes.
COVID helped us. And if we can go back, COVID-19 helped us. And if we can just go back and just adapt and just continue to. Some after peeing a drop. Oh God, the Muslims try a lot, because anytime they're going to pee, you see them with water. They want to wash, no matter what. They will look for water, no matter how small. They will look for it. But this is where we're going, because I'm sure we're going to go for a break. The COVID helped us to wash at every point in time. You know, there was a day, I don't know what happened. I just remembered that, God is saving us. Many of us will stand on the road and buy barley. You buy corn, you buy all the things. And you just tend to find out that of recent, you see all these people roasting the plantain, they wear gloves, some of them tell you don't touch it. And I love that. But in a situation in those days, anybody would come, how much is this one? Turn it, and you don't know whether the person has
just come.
Wow. I was passing one day, I was inside the vehicle, and I was stepping out, and I saw a man. He went to where the waste bin is.
Oh my God.
And he stood there. You know the first thing that came into my mind? I said, this man will go home, probably not have his bath, and then decide to sleep with his wife. Instantly, I thought of infection that, hey!
Yes.
What is happening?
Oh my God.
I felt like coming down to educate the man that Olga. Why is it that now let's see, men, I think men will believe that their infection is hidden, not like women own that after a while you start seeing it, and I know we are going to talk about it. But I mean, is it right for a man to be where you have waste bin? You know, you're win, and I saw that thing, and it really destabilized, because I felt like this one will go home. Like we are talking of washing our hands, you just go home, you will not wash his hands, he might not even change his boxers.
They will tell you I'm a man.
He's going to sleep with his
how do I get a toilet?
We'll come to that conversation. Let's go on and word of mouth. We'll be right back. welcome back from our water marble. We have been discussing toilet infection, and from what the pharmacist has said, you don't have to do personal hygiene. At this point, you have to prioritize your personal hygiene. But let me ask, can untreated toilet infection lead to very serious health challenges, like very severe health? And if it can, you can give us examples of what it can answer, because I feel like people simplify toilet infection. Every little thing after toilet infection. Growing up, I realized, because we had a large people staying with us, I noticed at a point I was having minor itching. Then it's not, I'm remembering, it's even toilet infection. And then I went to reach out to my woman, was complaining. She was like, okay, I know she gave me. It's now I'm realizing that because we had multiple people using the toilet and everything, and then she would make sure then we use, she would disinfect and clean everywhere. And then she taught us. That was where I learned how to disinfect toilet before using. If I get home, once I am entering my toilet, first thing I will use is disinfectant. Not because it's not clean, not because but I just want that mentality of that infection. Even to the children, if they come and say, if you use your school toilet, don't bring infection to the, I try to tell them, reduce the amount of school toilets you use. Just try. But can untreated toilet infection lead to very severe cases? Especially in men that doesn't show. It's not like women. By the time you have it, first, second day, you start having itches, the symptoms. But men, it's like a man's own will just be there growing, maybe because they are not open. Help us with that.
Okay, so toilet infections, they will show up more in, like, the symptoms are more in women than men, because it's easier for it to affect you guys. So the reason is, I'm thinking it's because the skin covering the perineal structure, let me just use that because maybe kids might be watching this. So the perineal structure now, it has a very thick skin that can prevent most of these things that will affect that lighter ones, squamous cells, the lighter ones there, right? So that inside of the vagina, that kind of skin is at the tip where we pee from as guys. So that's where we have those cells. So if infections are able to get into those places, then you start seeing symptoms in guys, apart from the normal jock, the yeast infection or the groins, where you see the skin peeling off, right? Now, to address the main question, yes, it could get serious. If untreated, they start growing up the lining of the urinary tract, and then they could affect the bladder. They could even go up to the kidneys too. Yes, and affect the kidneys. So the kidneys can also get infected, because it's a system that passes out urine. So if left untreated, it will just be traveling up, and it affects everybody. Once it starts affecting, it affects everybody. You might not experience the symptoms as quickly as a lady, because you see things like painful urination in men. We get that because of the injuries. It's the same with women, but it's faster for you guys for some reason. So you see women, when they want to urinate, it becomes painful. Your vagina is trying to clean itself, then you start having discharge. It gets so irritated, you start itching and all that. So these things are just your body's response. All those symptoms are just the body's response to most of those infections that are gotten through it, and if left untreated. And the treatment is getting lab tests first, and then getting what's the specific antibiotic to those infections that are bacterial, then getting the fungal ones and then the parasitic ones, right? Because we usually abuse antibiotics, and these things, they can cause resistance. That's one of the scariest things you can see.
Okay, now
People,
when you say resistance,
yeah.
What do you mean by it? Can you expatiate more what you mean by resistance?
Okay, so
it's
okay, so it's drug resistance to bacteria. One of the scariest things is even scarier than HIV, because you have an issue now. It's like going back before antibiotics were made. So you're trying one antibiotic, is not working. You're trying another one, is not working. You're trying, like, it's very scary. You don't know what to do for the patient. That's basically it. So that's why we always advise against self-medication, right? Yeah. But to answer the question, it travels up and causes more, the infection travels up, causes more damage. Yeah.
Now, when we look at the continuous use of tight or fitted unwears, male or female, can that activate an infection or cause harm?
Yes.
Infection or harm? Which one does it do?
Yes, it can cause you, can cause infection, which can cause you harm. So what happens is you are creating the optimal environment for this bacteria to grow. They need a moist, a warm environment.
Oh my God.
So if you give them that, they start.
You know, some ladies will tell you, I don't wear any, laundry is not my thing. I just want fresh sprays, and you see many of them when you're walking so far. And you're like, excuse me? Now, what would you advise in putting on an underwear? What would you advise? What manner of sizes should one? Exact size, more fitted size, or a little bit of free? Because you said it a warm and moist place. That is part of what causes the infection. So what would you advise?
Okay. So I advise a freer underwear. Basically for ladies, I usually advise a cotton pants, right? So you just wear a cotton underwear to help you to prevent, rather than just being exposed. Yeah.
Okay, because exposure, what can exposure do? So let's do that too. There is also a side effect to not wearing any. Can you help us with that too?
Well,
whether male or female?
Influence. I always say the vagina is very open, right? It's easy for anything to get in there, and that's why I don't really advise on just exposing it. I advise to cover it, but while covering it, you just cover lightly. That's why I say use lighter cotton pants. Yes. So I don't really
what about
advise
the males?
Males, just wear something breathable. Something breathable. If you're going to be wearing even tight trousers, it's going to hug the boxers. It's making it unbreathable also. So don't wear that for long. If you've maybe stayed out 8 hours, you can just change, because 8 hours is like the standard time for work. So once you just get home, I know we guys, we don't really take all these things. So, but just take your bath. Once you get home, take your bath, freshen up, do something light. Yeah.
Okay, now my head is already thinking. Hormonal imbalance, does it have anything to do with toilet infection at the rate at which, maybe let's assume myself and maybe a friend, we are in the same room and we are sharing the same toilet? Is there a possibility of maybe her own hormonal system activating the bacteria faster in her system than mine? Because sometimes somebody will say, but it's the same toilet and I'm not having any this thing. At the point I used to think I have a very fragile system because I don't use toilet in here. Because maybe it's a mentality issue. Once I sit on that this thing, the next minute my brain is heading towards toilet infection. And is toilet infection contagious?
Okay. So first things first, hormones and toilet infection, they don't really have any serious interaction, right? Because one comes from infection caused by bacteria. Although sometimes if you're like a woman now, if you're lacking some hormones, it can predispose you to being infected. It won't cause you an infection, but it can predispose your body, right? So I'll give an example. There are some hormones now. Okay, let's say for sex now, you need to be very lubricated for sex, right? And that place is dry, and then friction that comes in could cause you some breaks in the vagina, that will predispose the vagina to some bacteria or fungal infection. So it's not that hormones will just come there and cause you infection, but it can predispose you to those infections. Yes, so you can't, it's not, like, except it's contagious, it's not contagious. So, give an example now. It's going to take a lot for something like HIV now. HIV can be transmitted by bodily fluid, right? So if a lady's bodily, her vaginal fluid can go and mix with another lady's vaginal fluid, which will take a lot. If it's not a sexual act, it's going to take a lot for that vaginal, but it's possible, theoretically. Once the infected vaginal fluid goes into the uninfected, it's very possible to get it. But like I said, it's...
So can we say toilet infection is contagious?
You
You know what I'm asking? You use the toilet, let's say public toilet. Sometimes
Okay.
you enter, like Olori was saying, you enter some places, very lovely, and you're coming out, another person is entering. And you get in the picture already.
Yes, yes, yes.
And maybe auntie that entered had
That's
infection, and you're entering, and you're careful enough to use tissue and start wiping the edge, and then you want to flush. And
Some
you
take
sit
that.
in
Some take that.
Yes,
take
I
that
do. I would.
They go through the process.
clean, I
Forget.
would wipe.
They will wipe. Sorry, they have sanitizer.
They'll use it.
They will put it.
You know,
in it.
balance.
Ah.
Is there possibility of having toilet infection being
Possible.
Mm.
It's possible. But like I said, it's still very slim.
Okay.
But it's
very
possible.
slim. I want to find out. Talking about toilet infection, is it possible that the same toilet infection can cause a terrible, like you said, those who take antibiotics and it just takes care of the good bacteria? Why are you laughing? Takes care of the good bacteria and decides to leave the bad one. So the bad one will have the good opportunity, start taking effect, and be walking towards those places that is very nourishing for them to take effect. Okay. Yes, now they will look for a very good place to start walking and take their balance there.
Yeah.
Now, what is the result of these bad bacteria going in to cause damage, even to the kidney? Does it affect the womb? Does it affect the what other thing do we have in our system now?
Can
Okay.
even affect infertility? They say toilet infection.
Yes.
I can't
You
give
know,
birth.
I just want to know, because of all the self-medication some take, what do they really need to do rather than just taking care of the good bacteria and leaving the bad one there?
Oh, no. That's not what I mean. No. That's not what I meant. So what I meant is this. You might be taking care of the bad ones because the antibiotic is not like specific, that it's just saying, oh, let me go to the good ones and take them out. No, what I'm saying is it can be taking care of the bad ones and also kill off the good ones, right? So usually we advise you to use probiotics while using antibiotics, right? Yes. So if you're using a probiotic, and probiotics, they are different. That's what some people don't know. There are some for the stomach, some for the vaginal area. So if you go and take the one for the stomach, it's just going to help you with your stomach health, your gut health, right? But you have to take a probiotic that can help the stomach and the vagina. Like in this case now, we're talking about toilet infection. So you have to be going for something that has the bacteria that contained in the vaginal area. You can't be using the one for the guts and then trying to take care of the vaginal ones. Yeah. So then for the disease states, yes, if it affects the kidneys, it depends on how far and how long it travels. It can affect the kidney, and sometimes it can cause what we call sepsis. So sepsis is that there's so much infection in your system, and then your body responds with a like drastic, it just has a drastic response to it, and the person can just collapse, pass out. Yeah.
shit.
But basically, you end up in the hospital for that.
So what do they really need to do when you start feeling itches in your private part? What should be the first step? Can you guide us through all the steps to the finishing? That's my next question.
So you're talking of treatment, not prevention now. So
treatment first.
yes.
Now,
So
maybe we'll talk about prevention later.
Later.
But the treatment, when you notice there is any form of itch on any part of your private part, what should be the first thing to do? The next one, the second one, the third one. Please guide us through that.
okay.
So our viewers can understand.
So
better.
pharmacists are usually like at the end of everything. If not for our the way our health system is structured, the basic way health system is supposed to work is this: you have those, you go to the primary healthcare center. That's people flood the tertiary, like general hospitals, with minor things that the primary healthcare center could have taken care of. So you go to the primary healthcare center, you see the doctor, he will probably send you to the lab if he feels like you have an infection. He's trying to find out what exactly is this and what drug can I use for this. Now, on getting there, he prescribes the drug, he consults with the pharmacy. That's why he gives you a prescription, you go to the pharmacy. So if there's any issue with the dosing, anything that he missed, maybe you now came to the, because some patients, they are very funny, they just go to the doctor, they won't tell him some settings, they come to the pharmacy, they start giving us another gist. Now we now have to have that's why the prescription will come with the doctor's phone number. We have to call the doctor, we talk with the doctor, okay, see what's going on. That this patient now is just telling us that they have a kidney issue, so we have to kind of adjust the dose of the antibiotic he's using or something like that, and then we put some dose in, then we just give the probiotic. That's why I said pharmacists are the last. And so you go through the doctor first, you go to the lab to get your results, you report back to the doctor writes your prescription, you come to the pharmacy and then pick up whatever you need.
There are no emergency home remedies that one can quickly, even before sometimes itching can be very terrible. Sometimes you see some lady, it could be that worse, and you don't even have the ability to stand or to even stand up. That's when it's so severe and you didn't take. Is there any quick emergency remedy one can to douse the itching before you even think of going to the lab or something?
Okay, so that's why we always recommend prevention before things start, right? But we have some formulations that just have like the Clovinam now. The Clovinam insert is one of the most popular because it has a probiotic in it, it has an antifungal, and then it has an antiparasite, which has some antibacterial this thing. No, it's an insert. Yes, so you just insert, right? But the best.
Does the men too insert that?
No. We don't have our structure doesn't give us the luxury to.
We are best women. We are blessed.
Yeah, it's
okay.
So yes, so there are also some one-time antibiotic doses, which we still say some of these things they are antibiotics, so you need to see the doctor before you use them. But we have things like a day kit that can be used like from meeting doctors, and they recommending patients to us. They usually say use a day kit. That's one of their major go-to, because the a day kit has an antifungal in it, an antibacterial and an antiparasite. So these things can be used. Yes, however, I always tell people these things cannot help you with viruses. It can't help you with viruses. They'll just kill off bacteria, fungi, parasite. They don't prevent pregnancy either. So specific drugs to specific situations. So this is just it.
Can children come down with toilet infection? Can we have kids, like I'm talking of toddlers, can we have children between the age of 0 and 3 to 5, 6 that have toilet infection among girls? Is it possible?
It's possible, because toilet infection is what they call it. It's a hygiene issue. So you can get it anytime. You sweat around that. Yes. So it just boils down to hygiene.
When they're not monitored.
Yeah.
Okay.
But if it's a sexual one, because that's the point, and there are some things like women sometimes they have yeast infection, which is usually a hygiene issue, right? So you can't.
Infection is also hygiene.
Yes, it's a hygiene issue. So you can't call it a sexually transmitted infection. So because of that now, you can't start saying, oh, this person was sexually immoral. That's why they got the infection.
Some of them actually, some of them feel embarrassed. Especially they don't know the difference whether it's yeast or STD and all that. So because it's toilet infection, they find it kind of embarrassing to want to. I'm sure you understand what I'm trying to say. So please try and tell our ladies out there, it's not something that they need to be embarrassed about. They should come out, discuss it with a professional who will be able to guide them and come out and tell them the way they feel it. Please help us to where you are going. Please continue and please let them know for their own good.
Please, yeast infection, it is not sexually transmitted. It has to do with hygiene. Either you're too clean or you're too dirty, you get an infection. So for some of you that like using like feminine washes that have deodorant in them, some of you that just carry the towel and you're washing your vaginal area, you change the pH there, and once the pH changes, you're prone to infection. So please, and don't be afraid to come with your partners also to check these things, because if you're treating, your partner is not treating, then now treat yourself. The infection on your partner can reinfect you. That's why some of you come back to the pharmacy telling us, oh, this is what is happening, and I'll tell you, go back to the hospital. You can't complain to your doctor about some of these things.
Why is it that men don't like following for this treatment? You say, come with partners. No, sis, do you know that? Do you know that if a woman now go and meet, they say, hey, you're the one that gave me infection. I can never. Why is it difficult as we random? Why is it difficult that men should come in and with their partners treat infections together? Why is it that way?
There are different reasons. I can't just pinpoint one and say, but it has nothing to do with our field. So it's more of a human thing. We push blames around a lot. We speculate a lot. If you don't have conversations with your partner, you're not being honest with your partner, there are issues that will come up. So we can't say, oh, this is what is causing this, or this is what is causing this, because we have to check both parties to know, and we have to collect that whole data. We don't have that data.
Okay, they don't have the data, but the point is the man that didn't want to go knows why he didn't want to go. And the woman that is ready to drag the husband there knows why she wanted to do that. Really, in all truthfulness, the long and the short of what we're talking about today is for you and I to make a check on ourselves when the convenience in the toilet is very important, whether your own, private, clean it very well. And the use of, like he said, when you are too clean or when you're too dirty. When you're too clean is when you start using disinfectant to clean your vagina. It's not ideal. You can mix it in your water to clean the house or clean the environment. The water around your vagina is only enough. It has its own protection. It's just like your hair. It has its own protection around it. And when you're now trying to disinfect it, you are creating room for more infection. That's what it meant by too clean. And too dirty is when you are not even taking any, precaution at all to look at the environment, where you sit, the person you sleep with, or how you make yourself loose. Anyway, on that note, I hope you've been able to get one or two things, because our guest is finding it a little bit difficult to say those things, but it's better said by me because we are together in this journey, and it's good for you to be healthy. My name is Remain Olori Adechoke. I hope to see you tomorrow. Have a splendid day. Bye for now.
Alright, that's all take today on Healthy Thursday, and tomorrow we will be discussing revealing one's past. How important is it in a relationship? Revealing one's past, how important is it? You've had all those miscarriages and abortion, and you're telling your partner, how important is it? Tomorrow we're going to have that conversation today. Dr. V, thank you very much for being a part of the show, and a very big thank you to our guest that has told us what infection is all about. For now, this makes it about hand sanitizers. All right, thank you very much. We'll see you tomorrow. Have a wonderful Thursday. Be healthy. Check your BP. Stay healthy.